Now, when it comes to treating anything and helping your body just feel better in general, vitamin D. And the reason why is vitamin D will help the immune system calm down. That's one thing it does. Vitamin D, I always say, has superpowers. In fact, I have a podcast episode specifically on the superpowers of vitamin D. There's a really cool research, like with basically any diagnosis, vitamin D. So it helps calm down the immune system. Then the other thing vitamin D does is it talks to it's required for every single cell in your body. Every single cell in your body needs it. Nervous system cells, heart cells, liver cells, skin cells, all of them. They all need vitamin D. Now, Toby, you are in Oregon. That means I'm in Utah. We are above the 35th parallel, right? Pull out the maps, look at the altitudes and longitude and latitude lines. We're above the 35th parallel, which means from November basically to March, we don't make vitamin D from the sun. Zip, zero, none. Now, having lived in Portland, Oregon, where are you at in Oregon right now?
In Eugene, a couple hours south.
So you're the lower south part, where University of Oregon is, where all the track people unite.
Tracktown, USA.
Yes. My family was just there. I have a brother who competed at the Olympic trials. So he was at nationals at that new track meet, and then it was the Olympic trials afterwards. Pretty cool place. So do you guys get the rain all the time?
Mm-hmm.
Couldn't remember if it goes that far south or not.
Oh yeah.
Portland. Oh, yeah. I mean, I couldn't wait to get home in August one summer. Back here in Utah, we were going for a family trip to a lake, and I was like, I just want to go home because I want to see the sunshine. I want to know the sun still exists, because in Oregon it doesn't exist for like 10 months out of the year. It is rain, and it's not like, it's like a damp rain, like where the air is just wet. It does rain, but it's more of a damp rain most often. Anyway, so your vitamin D is zip, zero, zilch, nada, unless you're taking it in supplements. Now, here's the problem with people taking supplements in vitamin D. They're not taking enough. As we're heading into the seasonal depression era, is it really flu season? Is it really depression season? Or is it just vitamin D deficiency season? I'm going to vote vitamin D deficiency season, and I'll teach everybody who's listening right now how to prevent that from happening. 2,000 IUs of vitamin D is the most common standard dosage. 5,000 IUs of vitamin D is the most common. So between that 2,000 to 5,000 range, that's what you see most people taking. I mean, it's better than nothing, but your body needs more than that. And even I've seen labs from people in Georgia, Florida, Texas, the Caribbean, Mexico. I've seen labs from those warm areas where the sunshine is always there. They're deficient too. And the only way I can explain this is that the sun rays have to go through so much crap in the air before it even gets to our bodies. And then our bodies aren't designed like they once were to, I shouldn't say designed. Our bodies are still designed that way. They're not efficient at converting that sunlight into vitamin D. So don't just say, well, I live in Florida, there's no way I'm vitamin D deficient. Test. The vitamin D lab test is probably just as important as the CBC, in my opinion. So get that. The normal lab range for the test of vitamin D is between 30 and 100. I can guarantee you're going to still feel crappy if your vitamin D is at 35. You will feel way better if it's in the 80s. And that's where I try to give my patients. I say it's always better to have 80 or above. And if you're above 100, don't freak out. In my opinion, and from all the research I've seen, there's no way to have a toxic dose of vitamin D, maybe unless you're taking 50,000 IUs per day for like 5 years.
And you mentioned like 2 to 5,000 is like better than nothing, but oftentimes still too low for people. So what is a good dose for most
Yeah.
people, if there
Yeah,
is?
so this is my recommendation, okay? So it's like a 3-month, we're gonna jack up your vitamin D, just for 3 months. The first month, do 25,000 IUs of vitamin D. Yep, I saw your eyes, that's a lot. 25,000 IUs of vitamin D, it's a lot. But if you get a prescription, say your vitamin D comes in at 26 and your doc says, you need a prescription of vitamin D, here you go. That prescription will be 50,000 IUs of vitamin D, but you only take it 1 time a week. Okay, so we're gonna scratch that idea. Again, it's better than nothing. So we're gonna take 25,000 IUs of vitamin D for the first month. And then the second month, we're gonna drop down.
And that's each day, 25,000 IUs each day. Okay.
Yep, each day. We're gonna drop down to 20,000. Month 3, 15,000. And then if you're one of those people who just, maybe you feel really good on that vitamin D, instead of dropping down to 5,000 and taking that again, just take 10,000 IUs on a maintenance dose, especially if you're somebody who works indoors, even during the summertime season. So I've seen a lot of people benefit from just, you know what, I listen to your vitamin D protocol on your podcast, or I talk about it everywhere I can, because it's so helpful for anybody fighting really anything. It just, our cells need it. So when you're feeding the cells correctly, you never know what can happen. I've had people tell me that their anxiety and depression has been completely diminished and they're off their medication. I've had women tell me that they've gotten pregnant. They went from infertility to being pregnant when both mom and or woman and man took the vitamin D protocol. You never know what can happen. So just start taking it and see what can happen in your body. And then again, it is only for a 3-month period, and then maintain at 10,000. And if you want to, certainly test. Go into your doctors, or you can even buy some kit online now that will send it to your house. You can do a finger prick where you draw the blood with the finger prick, you put it on the piece of paper, send it off to the lab, and they'll tell you what your vitamin D status is. And again, if it's less than 50, in my opinion, that's low. You're not feeling good when it's less than 50. When it's getting around 80, 90, 100, that's when you start to feel good in a variety of ways.
Wasting my time.
You just can't help yourself, can you?